Hello everyone and welcome to my presentation. My name is David Mulama. I'm a nursing student at ECPI University. My topic of my presentation today is on challenges encountered by nurses in wound documentation during patient admission. This is my original work and it has not been published elsewhere. Before I delve into the presentation, I would like to acknowledge the following. This particular study was performed on the telemetry floor of Medical University of South Carolina, Lancaster Hospital, and I want to thank the management for allowing me to carry out the project. Special thanks goes to Dylan Baker, who was my mentor, and the unit manager, Courtney Rep. I'd also like to acknowledge the important role played by my fellow nursing team, led by the registered nurses, licensed practical nurses, and certified nursing assistants. To carry out the study, I did a literature review where I read and analyzed several published literature which were current to understand what was the wound. And the wound is any breakup in the skin integrity, and this can be through a burn, a cut, surgery, or trauma. A wound compromises the host immunity because the skin is the primary defense mechanism against infection. From literature, I realized that it's important that we accurately document wounds. The reasons why we do this is to establish the baseline for treatment and continuity of care, and also to demonstrate medical necessity. We also need to document wounds accurately to protect against legal risk that may arise. We need them to support billing and reimbursement. And lastly, we need to accurately document wounds because it's the law. We need it for regulatory compliance. But what was the situation on the unit? One we discovered was there was a lot of inconsistent and incomplete wound records. For that particular reason, we wanted to understand the reasons as to why this was the situation, and hence this particular project. This particular project looked at the challenges encountered by the nurses in wound documentation, because nurses are the ones that are directly involved in patient admission when they come to the floor. So the specific objectives wanted to understand if the nurses were facing any nurse-specific challenges, or if the challenges were related to the patients, or 3, if the challenges were related to technology and medical terms used. And after understanding these challenges, what were some of the strategies that we could employ to correct or improve wound documentation? To do this, the study was designed in such a way that it had 3 components. The first component was a training session where nurses were given information on wounds. The second session was a face-to-face interview where information that was not captured during the training session could be captured during the face-to-face interviews. And lastly was an implementation of a model documenting system on the floor. During the training, before the nurses could attend the training, they had what we call a pre-training assessment. And as one of the outcomes of the project, when we did the first assessment, we realized that the knowledge level was very much low, especially among the certified nursing assistant and the LPNs. Based on 10 questions that asked about wounds and knowledge about wounds, certified nursing assistant recorded a mean score of 41%, while licensed practical nurses had a mean score of 62.25%, but the registered nurses had impressive scores of 93.9%. The good performance of the registered nurses in this particular wound assessment could be attributed to the fact that they are the ones that are involved in assessment of any patient that comes onto the floor. We then conducted a training on wounds. We looked at types of wounds, characteristics of wounds, how to measure wounds, how to document wounds. And then I administered a post-training knowledge assessment. This showed that there's marked improvement in the knowledge basis. The certified nursing assistant jumped from 41% to 78%. The licensed practical nurses had impressive scores from 62% to 87.5%, while the registered nurses improved from 93 to 97.4%. This underscores the importance of training and refresher courses on the floor. The second outcome from the project was the unit report that I presented to the unit manager and the departmental head. In this particular summative report, I described some of the characteristic challenges that were linked to the nurses. Nurses complained that they do not have sufficient skills and that workload was a challenge. And technology and the medical terms used were not standardized. The nurses also complained that sometimes the patients were not cooperative, and this made it very difficult for them to document wounds accurately. Some patients will not allow the nurses to access certain parts of their body, and thus when a patient will leave the floor, the wound will not have been documented and thus will not have been treated. Through this particular summative report that I offered to the unit, the management was able to understand the frustrations the nurses were going through and promised to implement some changes to address those challenges, all geared towards improving wound documentation. We also implemented a strategy on the floor as part of this particular project, where it was mandated that every new admission will have 2 nurses documenting or assessing the skin. Because of this, there was improved and consistent and accurate documentation. There was improved teamwork because nurses were collaborating, and there was improved quality of work done because there was somebody watching over the other as they documented wounds. When it comes to the outcomes of the unit, one of the things that the management appreciated was that nurses were overworked, and for that reason, the management promised to hire more staff. Appreciating the importance of the training, they promised to have more frequent training of nurses and also improve the remuneration. The unit also implemented a 2-nurse wound assessment, and there was overall job satisfaction and regulatory compliance. The unit established a wound team that was to look at the wounds and correctly document. What is the application of my project to practice, education, or informatics? By conducting this project, I was able to learn leadership skills, the importance of mentoring, and quality control. Through the project, I learned a lot about clinical decision support. I also learned about project design, implementation, and execution. Ultimately, this particular project has taught me report writing, publication, and dissemination of findings, which I'm doing right now. What are the applications to future lifelong learning, career, and practice? Through this particular project, it has taught me the importance of leadership and collaboration. It was also through this particular project that I learned how to work in a team or improve my teamwork skills, as well as communication. It has taught me the importance of continuous education and project management competencies. And through the project, using the evidence-based practice, we're able to see improved patient outcomes. Lastly, I would like to thank and acknowledge several sources that I used in preparation of this particular project. I want also to thank you for your time and listening to me. And in case of any question, please feel free to reach out to me. Thank you.